Hi, guys, and welcome. Take two. Hi, Celeste. Thank you for joining me today.
Thank you for having me. We'll get it.
We'll get it. We got it. It looks right now. No more errors. So, guys, if you're joining us live,
Great.
welcome. It's great to have you. We had a little bit of an error in our first stream, so we're trying again from scratch, and everything looks good. If you're joining us live, let me know if you can see and hear us clearly. We are here to have a conversation with you guys, so please feel free to comment, discuss, share. Okay, so we're going to be talking today about the consequences of breeding for performance, which is a really interesting subject with a lot of unknowns, a lot of observations that have been coming out in the last few years, and theories and questions, and just a lot of things we could be doing potentially better to support performance horses, especially. So I'm really excited about this topic and to be doing it with Celeste. It's been a while since she's been live with us. It's really good to have you back again. Okay, so I see a few people live with us. Great, welcome, guys. Please let us know if you can see and hear us clearly. Okay, so Celeste, will you please introduce yourself to our audience and let us know what your interest is in today's topic?
Yeah, absolutely. I'm a licensed human and equine massage therapist. I'm a horse trainer. I run a rehabilitation and preventative training program, I guess would be the way to call it. I never know how to answer that question. I'm like, I don't know. I do a lot of things. But I'm the creator of Balanced Movement Method, if you've heard of it. And we do a lot of work around treating and working with a lot of veterinarians around the world on treating and preventing nerve compression in horses, primarily around the cervicothoracic region, so your brachial plexus, and then the hind end and the lumbosacral plexus are like our two main things. We do it a lot through focusing on developing the thoracic sling and then the correct core musculature throughout the horse, and that just kind of helps to provide us the ability for the horses to function and move through their body in a really good, correct way. And one of the things that I've noticed with this work particularly is that it works both for rehabilitation and it works for developing the sound musculature that we want. So basically utilizing the horses in the same way, you can get both responses. And what is neat for me about that is that tells us that we're kind of on the right track for releasing compensatory patterns slowly as we build up the correct musculature in the horse. And so we've kind of like biohacked the system is what it feels like a lot of time. That's like the feedback that I get. They're like, you just got to biohack this. And I'm like, that's cool. We got that. And my really big interest for what we've got going on for, in terms of breeding and, a lot of this is just observation. It's things that I've read about. It's a little PowerPoint slide that I'm going to throw up with links for published studies that everybody can look at for themselves. But it's really fascinating to me, particularly in sport horses, how many of them are breaking down and quite badly, and how often that they're doing it and that they're breaking down in very similar ways. We're seeing very similar trends, and not just me, but like all of my peers and colleagues around the world, we're seeing very similar trends in the sport horses. And the one common thing that comes up is like, why is it changing now? And it's not just like modern dressage. I think most of us can agree on is not great. It's not really on a great track in the way that it's doing its training practices, but it's not even just the dressage horses. It's across the board. We're seeing this. We're seeing it in the Western gaming world. We're seeing it in eventers. We're seeing it kind of all around. And I agree that our training practices have gone down a little bit in their quality versus how they used to be in the past, for sure. That's a big part of it. But another big part of it is really, I think, the breeding and the quality of the horses. So that's basically kind of the storyline that I want to tell, is what we've seen in terms of how people talked about horses from the dissections and the anatomy that they did, 100 plus years ago versus what we're actually finding today in the day and age where we have social media and people that are doing all these amazing dissections, that we get the chance to really look inside and see and compare the differences from the horses in the past to the horses today. So I think it's really cool that we get to have that.
Okay, I love that. So guys, if you're joining us live, really interesting topic today. It's going to be a great conversation, so welcome. I really want to invite you to ask questions and join the discussion, share your own observations and what you guys have learned. That's why we're here on social media live, so that you can join in the conversation with us. I think this is the first topic of the year that we can really tie into our Vet Rehab Summit, which I'm so excited about, because we're talking about the ethical issues that affect us as vet rehabbers. And this is tricky because a lot of the ethical challenges that are in our industry are not directly, but rather indirectly affecting us as vet rehabbers. And this is one of them. We're responsible for taking care of these horses, and for keeping them pain-free, keeping them functional. And it isn't an easy task. And there may be areas that we're missing that are a little bit broader or out of our hands, where we could have an influence. And I'm excited to kind of start exploring that subject. So what are some of the changes that you're seeing in the way that performance horses are bred or have been bred in, I don't know, the last 20, 30 years, probably?
Yeah, one of the biggest ones is hypermobility. And we're seeing horses that can do, particularly in warm bloods, but we're seeing it in, so I'm a big Andalusian person. We're seeing it in the Iberian breeds as well, some thoroughbreds. And what I mean by that when I say that is we're having horses that we're breeding for very exuberant movement, big flashy movement, that when you understand like the anatomy of the horse in terms of what muscles should do what, like I can look at a horse and tell you how they're developed and whether or not they should have a really good flexion and extension, and if they should have really quality abduction work for their, you know, for the job that they're doing for their lateral movements. Like you can look at the development of a muscle and say, these do this, and so the horse should be really good at this. The horses that we're seeing that have these incredible big exuberant movements and that are doing these big lateral movements, they don't have the muscular development to tell that story. So it's coming from like deeper compensatory issues that they're able to do, and it's coming from the ability to have that spring in the joints and like just that extra movement. It's not, so we've used breeding to basically bypass what used to take years and years of training to get that amount of suspension and extension and collection, and we're now just getting these big flashy movements without really the horse having to do anything. They're coming out as babies doing this, right? They're just super flashy. And so it used to be really cool to, you know, every once in a while you get like one baby that would come out that was a little bit flashier than most, but it's just now it's all over. But you're also seeing the difference in the quality of the necks and the quality of the backs. Now we have ECVM is like an epidemic. I have really big money clients that are trying to import horses all the time. And the difficulty of finding, and again, these are people that don't have really a limit on their checkbook, so this shouldn't be an issue to find them a nice horse. And the difficulty to find a warm blood for them to purchase that does not have ECVM is insane. It's insane. I mean, it's consistently insane from America, but especially from Europe. And that shouldn't be the case. Like we shouldn't be doing like 1 in 30 of our pre-purchases is about it. It's nuts. So that's terrifying. DSLD is another huge thing, right? And how that's affecting the horses and the distal limbs and their ability to just load. And we are having this significant breakdown all over. So these are like the main, severe arthritis in the lower, the base of the neck is the other big one. And so we're seeing that. Now we're coming out, I think Thurza Hendricks and Sharon May Davis have been talking a lot about what they're finding in the elbows now. So we're getting arthritis in the elbows. We're getting arthritis in the base of the cervical spine. We're having issues in the pelvis. But these are our main points.
Yeah, that elbow is really interesting. But yes, more. Okay, so the hypermobile kind of babies. Where do I start? I think it's a good point. Those flashy babies, because it's kind of like we've given ourselves the excuse of, but look, they can do this on their own. So why wouldn't they be able to do it under saddle and with us riding them as 4-year-olds, right? Because they can do it, but no. And I think the subject of hypermobility is a really important one that hasn't been brought into the equine industry because it hasn't been relevant until recently. But if we look at, you know, human athletes and dogs as well, hypermobility comes at a really high cost in terms of the health of other structures. It isn't even just the stability / mobility you know, cost that you're weighing. There's a cost to the other structures of the body, to you know, the internal organs, to immune disorders. It's actually a really high cost having hypermobility. So we need to think about that and how that's going to pull into the equines that are much flashier and much more mobile, and how we're going to protect them, because they do need that additional protection. And then on the cervical arthritis, I think it's really interesting that ECVM and then cervical arthritis are not necessarily, they're not the same thing, right? Because at the moment, I think a lot of us are just using them interchangeably, but the cause is different and the pathology is different.
Yeah, no, it's very different.
It's very different. Yeah. So we have a webinar coming out next month on cervical arthritis, which I recommend everyone watches. And we had one on ECVM a few months ago with Martina Neidhart. So if you guys want to explore those two different conditions and topics, then definitely do that. But both of those were a big eye opener for me. So just these are really important. And as these conditions are coming out, let's talk about our training and how our training isn't actually adapting to what our horses need and is going in the wrong direction there.
Yeah, absolutely. No, I'm so happy that you had Dr. Martina on, because I specifically didn't really dive into ECVM at all, because I knew that you had her on, and I was like, she is so incredible at all these things. Like Dr. Martina, Sharon May Davis. I really encourage everybody to follow Bex Nairn too, as well, just to see the pictures and to see like what it's just amazing. It's incredible. Like we have so many incredible people that are deep diving into this, and it's like, the information's there. We just need to track down the people that are able to talk about it, really, or that are willing to talk about it. Because that's the other thing, is it's not, these aren't things that a lot of people want to hear. The ECVM, the breeders don't want to hear about it. They don't want to talk about the fact that their stallions that are producing this, like it's a lot of money, it's a lot of stress and politics, and it's not easy.
But yeah, I mean, it's insane to think that they're continuing to breed ECVM because there's a financial gain at the end of the day. But it just, talk about ethics, right? That's no.
That's a big one. And so so ECVM and cervical arthritis are not the same at all. Cervical arthritis is something that the horse gets, right? Excess heat and loading, whatever's going on, the body is putting down excess calcium. So now we have excess. We get arthritis. The horses are born with ECVM. They don't become ECVM. So that's your like core differences, is one you get from excess loading, one you're just born with. And that's a very, very big distinguishable difference, because there's nothing that we can do for the ECVM horses, right? And I tell people, like, we have some horses in our program that are doing really well with the work because they're able to, for whatever reason, the way that the attachments are and the way that they go around the nerves, they're able to function pretty well when used appropriately. And you have to be really mindful, like if they start to do a lot of inverted work, or if they start to go really behind the vertical and those things, their symptoms will come up. So as long as you're really careful and correct with them, they actually do quite well. And then we have other horses that, because of the essence of their morphology, when they do like pillar one, when they just do like a really basic work with mine, it'll make them completely unstable and neurologic because they needed the compensatory patterns. And so we kind of use it diagnostically on a lot of these horses to be like, what are you capable of doing? Not that we shouldn't do that for all the horses, but the ECVM horses, you have to be really, really you have to very much listen and track every little thing that they do, because it can be very significant, in terms of the nerve compression and impingement that they can have from it. So it's interesting.
I love that. And in the latest webinars with Dr. Uhl and Osborne, Michelle Uhl and Elizabeth Osborne, it's really interesting because they dive so deep into these specific topics. But one of the things that they talk about is that there is a lot of redundancy built into the anatomy of the body, which means that one muscle or structure can fulfill the same purpose as another. And so when you have something like ECVM, the body can find different pathways to adapt and to compensate. It isn't that only one structure can do only one job. There is capacity for change and for adaptability, which is really powerful. And that kind of relationship would be part of what you're seeing there. And if you try and correct that to what is correct, for that individual horse, it doesn't work. because
not
they're
work.
not built the same way. So I really like that. Just that thought pattern, really challenging us to think about what is right and what is the best for this horse or this patient. Yeah.
Right. And that's the only way that you can do it. And I try very hard to really educate people on that. So with my work, it's like, yes, there's like a certain methodology that we go through, but it's just as much diagnostic as it is development, because the whole time you're doing it, there are certain cues that the horse will tell you if it can do it or if it can't. And we judge it based off of the nervous system. So if the horse is relaxing into it and really enjoying it, then I take that as a cue that it's a green light, we're doing okay. But if the nervous system starts to go more into the sympathetic and they're like, this doesn't feel good, I'm getting a little bit stressed out, I'm reluctant to do this, we back off, because that tells us that there's something in there that's not comfortable. So it's really all about reading the horse that you have. And like, yeah, sure, I can tell you what the correct musculature that we would love to have developed in a horse. And that's always our goal that we're trying to get to, as long as the horse is able to stay in the parasympathetic the entire time with it. But if we're doing that and it's causing any kind of an issue, it doesn't matter what you're doing, you should back off, because the minute you're implementing force or you're asking to blow through that, you're no longer listening to what's going on inside that particular body. And we have no idea what's going on inside of that particular body. We can only listen to them as best as we can. I mean, that's just horsemanship.
Yeah.
And I think that's hard for people to stick with, because we want to be like, and this is how you do the thing. And it's like, it's not how that works though.
So how adaptable are we to our patients and what they need? And how easily do we change our course or adapt our course to achieve our goals? I think is really important. So let's talk a little bit about riding and training, and how the kind of normal riding and training has changed over the last couple of years, and how that has failed to adapt to the changes in performance horses.
Well, there's a lot. I think that one of the main things with that is that money. People, it costs a lot of money to keep a horse. This is just our, boarding costs a lot of money. Training costs a lot of money. It's the same reason why people are not adhering to starting horses later, even though the science is saying don't start your horses till they're 6, because that's 6 years that you have to feed and take care of and house an animal before you can even begin to start training. And then if you're going by the correct, slow training progress, where you're really slowly developing the muscles and the mind and the body to do the job, you're looking at another 4 to 6 years usually, right? So now we're at 12 years that we've had to pay for a horse and then pay for the training and invest the time and do the things before that horse is marketable at the rate that we are now marketing horses when they're 4. That's really the big one, right? And then there's the ideology around the fact that we just want to get out there and show sooner and faster and have that out there. But I think a lot of it is more the campaigning, because as a trainer, you want to have as many horses that you're campaigning at a higher level so that you can show your work. As a breeder and a seller, you want the horses campaigning as big and as hard and as early as you can so that you can showcase what you're doing. And then you don't have that overhead of the fact that you had to house a horse for 12 years before it was worth $250,000. Instead, I'll just have them be doing 4th level by the time they're 4. And then I can have that, 4 is much cheaper than 12. That's, so I think that that's the majority of it. Because as is with most things, that it kind of comes back to money in a lot of issues and politics, which is typically also money. So
yes, isn't that unfortunate and just wrong on so many levels? Do you think that we stand to lose our social license to operate in this arena of riding horses? Do you think that's a risk?
I honestly don't
for that one.
No, it's okay. I honestly don't know. I don't know that we ever would. It's a lot of I try to explain it like in human politics and things. It's like bad guys are going to do bad things.
Yeah.
We see it. I don't know that anybody would ever have the power to fully remove the social license to ride a horse. I don't think that it is that. And, you know, I don't. I do think that what I love about social media is that we have the ability to highlight the bad in a really unique way. So you don't have to, like, you know, before everything is very like hush hush, like everything that went down with Helga Strand and now several other big trainers, that happened purely because of social media. It happened because someone could go in there and they could produce a video to the masses to really lift the lid off of that container and really lift off all of that dampening spells of like, oh, no, everything's fine. Everything's fine. It's like, no, when thousands of people around the world can all look at a video and agree that this is abuse, then somebody has to do something about it. And we saw that, you know, with politics, we saw it with Black Lives Matter, we saw it with all kinds of things. There's a different animal when you get social media involved, so you can almost like shame them into better behavior or at least being corrected. And so I do think that that's really beautiful and powerful. So I don't think that without what we have, that we've been able to get the changes that we're getting and at least the awareness. And then there's people like your guys' group. I try to be really active on Facebook. There's so many incredible, you know, equine influencers, if you will, that are coming forward and saying, hey, like, behind the vertical is really bad. How you're training in this stuff is really bad for the horse. And we're showing the anatomy, we're showing the nerves, we're showing a better way of doing it. We're educating, and that's allowing people again to think for themselves and not just accept that what they're saying at the top levels is okay. And so that I think is changing a lot. And I think the more that we can do that and the more that we can educate and have people think for themselves and find that there are other solutions, so that they can compete. I mean, I love competing. I don't think that we should just stop necessarily, but we need to scale it back and kind of go back to what it used to be, where it's like we compete to showcase the fact that, like, look at this amazing thing that we were able to do with this horse. Look at the development, look at the bond, look at how good our relationship is. Look at, you know, like that's what you're showcasing, not how quick you got the horse to fourth level. That's not, you know, that shouldn't be the metric anymore. It's not the vibe. And I think that the culture is shifting a lot into the vibe is more about relationship and connection and throughness with the body and being able to visually see what's good, which is awesome because that's not what we see at top levels at all right now.
No, I'm very excited about the shift. It feels like there is a shift, and then
I
sometimes
think so.
it feels like nothing will ever change. But at the end of the day, you know, if a small percentage of people on the ground are changing the way that they're working with horses, their horses, the way that they see their horses, then that is a change, and that's worth pursuing. So it doesn't matter if we can't change like the top guys with all the money, because we're making a change on the ground. So I think that's important to remember, is to just not get discouraged on this journey. And I think that I actually lost what I was thinking.
That's all right.
So
it's all good things.
It's all good. I don't see. Do you want to put up your slides, Celeste? We haven't seen anything that you've prepared for us.
Yeah. So that's all right.
We'll shift.
If I'm being completely transparent, this is, I'm going to kind of skip around a little bit on it because this is actually a slide that I did for one of my courses where we just got to explain stuff, but I threw a bunch of pictures on there, and I told, and we can in the comments maybe or afterwards, if you guys want the actual like hard links to the published publications. I don't know. It's very early here. We can post those so everybody can take a peek at that. One of the big things that we're seeing, if I can find all my buttons here, one of the big things that we're seeing.
I see it now.
There we go.
Full screen. Got it. It's up.
All right. So the biggest thing that we're seeing, I think that most of us can agree on across the board in pretty much every discipline, specifically dressage, I'm going to pick on dressage a little bit on this one because it should be the correct one, is horses going behind the vertical. It's chronic. It's everywhere. We see it nonstop. And I really dove into this quite heavily, and this is something that's been heavy on my heart. because I had my mare that I just recently had to put down. We found the underlying cause for why she started going behind the vertical, and I'll kind of dive into that probably on another day. But for the last 3 years, I have been like chasing this subject very, very hard because I couldn't understand why she did it. And so I got her when she was 10. She had like very lightly been started. She only did trail riding. I only did trails on her. I tried her with a bit. I tried her without a bit. I did everything that I knew to do. And the minute you would put pressure on her, she just wanted to go behind the vertical. It wasn't something that she was trained. And I've had horses that have done that in the past, which is always very fascinating to me, because a lot of the ideology that we have in the world is that it's the training that causes them to do it, that the horses don't do it naturally. So when I find horses that naturally go into it, I'm like, that's really interesting. Why are they doing that? And the big thing that I came across for alleviating it was developing the thoracic sling. And back when I started doing it, I didn't even know that the thoracic sling was a thing. I didn't know anatomy very well. Like, this was many moons ago. But I knew that if I could get the horse to lift and engage in its sling, it no longer went behind the vertical. It was as if the two things couldn't operate at the same time. And now I know that that's true due to the nuchal ligament and the supraspinous ligament. And there's a lot of science around that. But if they're inflated in their sling and they're using their core, it will actually pull their head forward. But if they are trying to function and move through space and they don't have the ability to lift and inflate through their core and their sling, that kind of suspension bridge curls in, and that's when they go behind the vertical. Now, obviously, it's absolutely a training problem. We can see the people that are cranking the horses, doing the whole crank and spank thing. So it is a training thing. And it's also important to understand that it's also a cause and effect. So that's just a little aside of like how I kind of started chasing this in the first place. So what I want to talk about with everybody is to just take you guys through a little history of the nuchal lamella that comes down into the cervical spine, because I think it's, to me, my belief system, this is where a lot of these things are going wrong within the horse. So this is our funicular cord to our nuchal ligament, and it comes in and attaches at the base of the skull, and it comes down, and then it ties into the supraspinous ligament that then runs down the whole of the body. Off of the funicular cord, we have the lamellar attachments, and they come in and they attach down into the individual cervical vertebra. In a lot of images, it'll even show going down and attaching into T1, which I found really interesting. So this initial illustration is the oldest one that I could find. It's from George Strubbs. He was an English artist showcasing attachments all the way down through C7. It was first published in 1766, and his work, when you look at his books and you read all the research on it, all of his work was based on numerous dissections that they did. So one could assume that because they're announcing that, they're doing it off of they're cutting up the horses, they're doing the dissections. And back then it was like really not very popular to do dissections. And so they were very thorough. They didn't get to do very many of them because it was seen as quite morbid for the times. And so they had to be really, really, really careful with it. So his work is really what formed all the anatomical knowledge that was taught in numerous educational resources, especially the veterinarian textbooks from back then, and then carried on. Let me see if I can go to the next slide here. So then this page, and then the links are on the bottom. Again, we'll do this. So these are getting into some research articles that Sharon May Davis has done. So I think that it's really interesting just to look at the diagrams of the nuchal lamella according to the different times. So we have in the 1700s, we have Strubbs, and then we come into 1899 and we have Ellenberger. So it's also showcasing it all the way down. Smith and Goody showcasing it all the way down. And then again in 2000, it's showing it. What I don't know, and I've inquired about, for a couple different people, I haven't heard back yet, did Smith and Goody, were they getting these diagrams off of dissections, or were they doing it because that's just what we know the structures to be from in the past? I don't know. So I don't know if they did dissections in the year 2000 and that it was showing all of those or not. I really don't. But it's just interesting to see that that's what it was. And then we flash forward into here, and this is coming into in the last 20 years as Sharon May Davis has been coming forward with her findings. And what we're finding is that the nuchal lamella attachments are absent. They're completely gone from C6 down through here. C5 in a lot of these, and again, you can read the whole studies in these, but in C5 and a lot of these are also either missing or very, very frail. C4 is also a little bit on the frail side. So I think that is a really big telling story, because your lamellar attachments come down and they work to suspend and support the cervical vertebra. That's its job. It's kind of like you have the suspension cables on a bridge, and then they come down and they hold things up. So they're suspending and they're holding up all the way down through here, but through the years of something has changed in the last 100 to 200 years, where the structures are now diminishing. And I don't think that it is coincidence that the same areas that were having ECVM also are missing this. They're not caused necessarily from one another, but it's the fact that the breeding that we're changing for the hypermobility in these areas, this is what we're affecting. And now these structures are disappearing. And for ECVM, the attachments, right, the transverse processes of these vertebrae are gone. They're missing, or they're rearranged. And now the nuchal lamella is also missing. And what this means from a structural standpoint is that cervical spine is no longer able to be supported. And so it's going to have excess movement is one of the things. So that's kind of my theory on where a lot of the cervical arthritis that we're seeing is coming from, is the fact that there's so much movement going on in there versus where it should be stable. And it's not to say that you don't see arthritis up higher too as well, because you can get it from bad training and excess loading or a pullback episode, or like there are other natural causations for it. But the severity and the amount that we're seeing in that area is pretty quite high. And I do not think that it's a coincidence that it kind of coincides with the fact that it's not supported in that way. We're also having, when it's supported, it's also supported from having nerve compression and from running into our brachial plexus and having that support, and that's gone. And how many horses do we palpate and see that are really sensitive and sore in that area because things can move around? We're also seeing horses where they have the dip in the withers. Dr. Rachel Bellini, if you ever get the chance to talk to her, she's one of my favorites to talk about the spine. She's a veterinarian, a chiropractor, an acupuncturist, you name it. She's certified in it. She's a spectacular woman. I call her the bone witch, because she can just, the things she can chiropractically do to a horse are like out of this world. But the way that she explains it is, she's like, when the cervical spine isn't supported, and so when they don't have a good thoracic sling, when the spine is not supported and suspended correctly in the best way that we can get, this lower cervical spine now has the ability to drop down. And so when you see the horses that have like the dip in the top of the withers, it's because T1 and C7 have dropped down because they're inflated. And we'll see that in the change in neck development when we're doing things like, a lot of people see like our before and after photos, the horse's necks all of a sudden change shape. And it's not so much that the neck is changing shape, it's that the support of where the cervical vertebra is can actually come up and open again, which is, I think, really cool that we can change it. But the other thing that I really want to point out about here is I want you guys to take a peek for how big and how strong the attachment into C1 and C2 is. Like coming down through here, like that's really thick, and then it gets more and more thin and frail. And when we see the horses that are going behind the vertical, where are they going? They're going C2 high. We call it broken at C2. And so when I look at this and I just think like kind of common sense painting a picture here, if a horse is not developed through the sling, if they're kind of being crammed into a frame that they're not ready to do yet, the only place of support that they have really for their base of their spine would really be here, honestly, in terms of how it's supported into the back, right? So that's my theory on that for us to look at. This one, I love how she explains it. It's going into like her ring of muscles, and it's just a little, and again, everybody read all of the articles, but I like how it talks about the suspension bridge and how the dorsal ligament system kind of comes down and just works as a passive suspension system, because it's a really important thing for the horse's entire body that this is operating correctly. And when we think about it operating correctly, and then we realize that they really only have a base of support through about here, not a lot here, it's pretty scary. To me, I think it's pretty frightening to see that the horses don't have the support that they have. So I'm going to get into, I just wanted to showcase a difference between horses. And again, this is just so you guys can think about it for yourselves, paint a picture. So 1950, I think I'm going to go back here. So 1952 was when she went in originally. So 1952, this is Lisa Hartel and her mare Jubilee. Lisa was also paralyzed, which I think is spectacular. She was just an incredible hero of a woman, but she was the first woman to win in the Olympics. And this is a mare. And I want you guys to look at the quality of this mare's neck versus Valegro. So we have a warm blood stallion. So stallions are typically known for their better necks. And then we have a warm blood mare structurally. And within the theories of the dates and times that we're seeing in the changes of the nucleolamellar attachments, it is very well possible that Jubilee had all of her attachments. And I just think that it's interesting to kind of look at the way that the horse wants to come in. And we can argue that, and not even argue. I mean, I will fully admit that the training, I'm sure, is spectacularly different between what Valegro had versus how Lisa rode. She was an incredible rider, an incredible trainer. And the structures of the neck are just very different. And you're going to see this in the different movement as well. When I look at this picture, knowing what I know about horses, and this is where this one and the next one I'm going to get in, and I'm probably going to offend a few people, and I do apologize for that. I do think that Lisa is a hero. But knowing what I know about horses today, which is what I've learned for the modern sport horse, when I look at this horse's neck and I see how rigid she is through the bottom, and how you can see the lines on the scapula, I look at this developmentally, and I don't think that she should be able to lift and to keep her head as upright and open as she is. If we saw that development on the horses today, which is very similar to what he has going on, he's rigid, he's hollow, there's a little bit of lines on the shoulder, and then he curls. And then we can continue to argue and we can say, well, it's because of how Charlotte's holding him, blah, blah, blah. But if you look at just his neck, that's a huge difference between the quality of the neck on these two animals. And similarly, you know, we talk, and I'm not the only one that says this anymore, but, you know, when we look at horses that are a little bit hypertrophied in the brachiocephalicus, that typically means that they don't have a really well-developed thoracic sling, because the two are antagonistic. And I can tell you by looking at her shoulders and in other pictures and videos that I saw of this mare, she didn't look as beefed out in the sling as like I would like to see a horse. However, she was incredibly correct. She always had her pole at the highest point. She had no problems lifting. She had no problems driving with her hind legs. Like, she was doing really well. She was a structurally sound animal. So why did she not require as much correct development as with the horses that we're seeing today? And I think it's because she had the support. She actually had the ability to be supported through her neck and into her sling and her body. And so she had access to it. Whereas the horses today, they're hinging off of that C2 if they don't have that support. So those are the main things that I wanted to offer and show. And then I think I threw, oh, and here's a little baby. But look at, so talking about the little babies, but look at the amount of tension that's coming up through the splenius already and the curvature that's coming on here. Right? This is a little brand new baby foal, very cute, but you're already seeing the patterns in the neck. It's wild. So it is a training issue. I will be the first person to advocate against that. And I am, and I do. And we also have to understand that it's also what we're breeding into them to do, and that we have to be so very careful. Otherwise, we're just going to continue to exacerbate the issue. If you guys haven't seen this is on Thursday's website, but it's just a really clear image of your thoracic sling. And when we look into like the serratus and how it ties in and how everything works together, this is kind of, you know, we've got the scalenes and the longus coli come in and really support that cervical spine, but nothing really helps to kind of suspend it and to keep it upright other than the serratus, which is interesting. And I think that it's, I don't think that it is coincidence that as the horses' slings get developed and the horses' bodies get developed, that all of a sudden we see a substantial change in the neck versus that. So it's why I'm so passionate about, I'll kind of stop sharing there, but it's why I'm so passionate about, I don't know how to get
Why did you take that down?
I pushed the button. Shit. Sorry. Oh, sorry. Now I'm swearing online. Come back. Anyway. Well, that was the end of it, but if you want to see that image again, go to Thursday Hendricks. She's incredible, and she has a whole thing about it, and so you can find that image on hers. But I'll send you the links for everything on the other ones, and they're all published. They're all published papers. If you go on Google, you can Google missing nucleolamellar attachments and Sharon May Davis, and you'll see all of these in detail. So anyway, there's my brain dump for everybody. That's what I'm chasing right now.
No, it's very interesting. So one of the things that I took from that was that we can't actually compare the horses from 100 years ago to the horses today in terms of how we're working with them and how we're training them, because we're seeing different things. We're seeing them cope with work in a different way or not cope with work in a different way. And our training hasn't, yeah, I mean, our training hasn't adapted to support that. It's kind of adapted to worsen that.
Yeah.
Yeah. Okay, great. So we're not comparing that apples to apples. And then the other thing that I picked up was, when I mentioned earlier that in our webinars with Michelle Osborne and Dr. Ull, they talk about systems of redundancy built into the anatomy where one structure can compensate for another structure. So they can be, anatomically, there's support to have that, to have different functions filled, right? And if we look at the image of the serratus from the scapula to the cervical spine, that's kind of filling in that space that's missing with the nuchal ligament, right? So if we're talking about
the only thing
what
that
I'm aware of that, so if we're missing that portion of the nuchal ligament, then can the serratus support a similar function by lifting and then creating an area of support, but then recognizing that serratus has a job. And if it's doing a different job to the one that it was created for, there will be some kind of cost involved, which could be why this weakness in the thoracic sling is more significant today than it was 100 years ago, because they're using their thoracic sling for a different purpose, not the one it was intended for. And so it's not, we're seeing a different picture. So I think that's really interesting. You see, I learn something every time I do these.
I love it. I learn something every time I get a rabbit hole and I'm like, well, what's causing this and how do we fix it? And how do we, you go through the whole thing. But I was recently talking to a saddle fitter so differences in language is a big thing, and it can either be good or bad. And so one of my favorite things to play with is because I think a lot of us see and say the same things, but I think that we're saying them very differently. And so you think that you're saying something in opposition to somebody else, and you're really not. And I've done this long enough to know that if you are of a certain quality of a horseman, body worker, veterinarian, you name it, we all should be seeing very similar things, and we should all be saying very similar things because it's the same body that we're talking about, right? So if there's something that's like drastically different, there's something that's just not right there. So there was a saddle fitter I was speaking to, and she was talking about one that I really respect, and she was talking about how she needs to release the serratus in order to get the horse to activate. And she was saying release, which I think is interesting because I say activate the serratus because I'm trying to develop the serratus. And she says, no, she's like, the horses that I'm working with, I have to be able to release it because it's so tight, because it's doing a job that it shouldn't be doing. And it's not developed necessarily well, so that the horses are really, it's almost like causing more contraction. So she goes in and she's trying to release it. And she's like, I don't know why you're trying to activate it, because like the muscle needs releasing. It doesn't need activation. And I'm like, there's no way that you're getting the changes that you're getting and I'm getting the changes that I'm getting, and we're doing this opposite. Like, there's no way. So I got on the phone with her and I was like, we need to talk about this. Like, I want to just run me through this really quick, And so we're talking about it. And I was like, so what I'm hearing is that you're finding the horses that I would look at and I would say they need to be developed better. And it's not just the serratus, like the whole sling works together, right? So the serratus ties into the scapula. So if the pectorals and the scapula and the trapezius aren't well developed to support what the serratus is hanging off of, it's not going to work either. It's not one or the other. So I said, I think that you're releasing the serratus because you're feeling all of the tension, and I'm feeling all of the tension because it's too weak to do the job that it's doing. It's overstrained. And so I think that releasing muscles so that they can activate better is a really good sign. But what if we played with releasing the muscle so it can work better, but then activating the sling through these like targeted exercises, assuming that the horse can, and seeing where it goes from there. And she was like, oh yeah, no, absolutely. That's it. And I'm like, okay, good. I'm glad we're on the same page. But that's why it's so important to talk and not just, look at what somebody's saying and reading and then poo-pooing them. It's like, why don't you investigate that a little bit more and see? Because the more we can. So then we found a common language between what we were both seeing and saying, and now we can better support each other's program a little bit. And I can be like, yeah, absolutely go to her because she sees this and she's doing these things with the saddles. But the serratus being damaged by bad saddle fit is where she was getting off on that, which is huge. So she's like, it can't activate because the saddles are pinching on it. And so then it's working the whole time because it's doing a job that it shouldn't. So it's just under strain and pressure. And it's just all fascinating. Anyway, I could go on I always go on too many soapboxes. I apologize, but I'm like,
no, please. I love that because I have exactly the same thing. I love speaking to different professionals outside my own profession because their perspective is different. So the way that they look at the same problem is a little bit different, which means they're getting a slightly different picture. And when we overlap that, we get a better picture. But we can only do that if we talk, and we can only do that if we talk to understand, not talk to prove that we're right and that this is the way it works, right?
Yeah. And I just kind of, my default is that everybody knows what they're doing and they're making good changes. I mean, and not everybody, obviously. There's going to be people that are doing things that we don't agree with. But for the most part, I do think that, and for all of it, I really do believe that we're all trying our best and that we're at least trying to find the right things. And so even when you find somebody that you're like, I really disagree with that, if you just ask them why they're doing it and what their approach is, and then you can offer a little bit of like a different take on how that's happening, I think that can really help. So with the behind the vertical things, the other main thing that causes that is what's going on within the horse's tongue. So when people ride, they tend to ride with a little bit of a backwards pressure versus upwards into the corners of the lips. And so there's a little bit of a tongue sandwich going on all the time. And so the horse begins to just low key this just a little bit. They're working those muscles of retraction. Your hyoid is embedded into your tongue. And then we have our deep ventral neck muscles that attach up into the hyoid, that attach into our sternum and our subscapular fascia. So every time those muscles of retraction kick on, the horses are doing this. And this and this. And when they're doing this, they can't open and use their sling. So where do they go? They go to their pole. They go to C2. And so changing bit mechanics and allowing for the horse to be able to actually open is a really big thing that we do. And so I have a really sweet woman here. She's staying at my ranch with me for a week, and she came in because her horse is like repeatedly going behind the vertical, and they're like, we can't fix it. No, we've done all the bits, we've done all the things, and he's trained up through 4th level, but I can't get him to go behind or stop getting behind the vertical. And he has all of the same patterns that we see. And so all we've been doing is playing with getting the right muscles online. And then I rode him yesterday for her, and we changed the bit mechanics, and all of a sudden he could be up and open for the first time ever. And she was like, all you did was play with his tongue. I'm like, that's all I did, because the tongue governs the whole thing. And so it's just these little things. And I just think it's important to talk about, because people, going back to like, are we going to lose our social license to ride and show? I don't think that we are, but we can't, I don't know that we're ever going to make a difference. We can certainly shame people out of it, but these people want to compete no matter what. But they've gotten to a place where they have either, they don't understand the bit mechanics, they don't understand the anatomy, they don't understand what's going on to an extent. And so they're just doing the same things over and over again. And what I loved about my conversation with my client is she said, because she's been in the dressage world for like longer than I've been alive. And she said, what's frustrating for me is that you're able to fix these things that we struggle with every day, right? Just through understanding the anatomy, just purely looking at the anatomy. She said, you're able to understand it and we can fix it. But these are the same things that in the dressage world, we whine about. Like, we're constantly whining about the horses are going, like, we don't want the horses to go behind the vertical. I don't like the fact that they're crooked in all of their lateral movements. I don't like we struggle with these things so badly. But then what I'm learning is that the way that we're training is what's causing it. And I was like, yes, that's the issue. And it was just this really interesting, she called it her ego eradicating moment, which I love. She was just like, she's like, it's so cool that we can fix it. And it's wonderful to see him. And his neck was really happy. He also, like, he won't eat anytime he goes anywhere. And like, as soon as we got done with her, he'll like go on strike. And that was part of it. When she warned me, she said, it's going to be normal for him to not eat. He stops eating at shows. It's just part of his thing. And then we have to treat him for ulcers. It's his pattern of stress. And we got done with one session and he went in and he's been chowing. He eats just fine. He drank all of his water. And it was like, he's just uncomfortable. I think he just goes to shows and he knows that it's going to be, or he goes somewhere new and he knows that this thing is going to happen. So he goes on strike. And so getting to watch the behavior change, and his neck looked like jello and he was so happy and he wasn't stressed out anymore. And it's like, we can do this. And so what I'm getting at is that I was able to give her an answer so that she can still train and she can still show. I'm not telling her that she can't. We just have to tweak a couple of things and maybe back off the lateral movements until the horse is physically able to do them, and then go through it. And she was so happy and so willing to do it. And so many trainers, I think, it's like they're afraid that if they tell the clients to slow down for a minute, that they're going to lose the client. And I very rarely see that to be true. I very rarely have ever presented a client with true, like with the science and with basic anatomy and with tools of like, this is what it's going to take to get the horse to where you're getting at. You might have to take 90 days of doing like some gentle walk work and things, and then we'll go back. Very rarely have I ever seen them been like, oh no, I'm not doing that for my horse. They really love them. They really want to do better, but we have to be the ones to show up and say, and this is what it's going to take, you know, I think.
Yeah, I think. Okay, so we have a question. Thanks, Molly. Do you think that's why Charlotte rode with her hands so high on Vallegro, to try and keep his nose out?
Yeah, I do. I think that the trainers that know what they're looking for and that they really are trying to get the horses up in them, because I mean, they should be docked down quite a lot for having it curled in. But it's like, yeah, I mean, like they're out there and they're trying to get their heads up and high, but they haven't changed enough of the other little things that are causing it with the contracture with the muscles. And again, being mindful of the fact that I can look at his neck and tell you that he very clearly doesn't have those attachments, right? It's very dippy, and then he's on the top, and he's an incredible stallion, but he's struggling physically with it. And so you can try to bump it up and do that, but they can only come as open as those muscles are going to allow. And so if his tongue has been sucked back in the back of his throat for so long that all of these deep ventral neck muscles are hypertrophied, and his TMJ is locked, and his AO joint is stuck in flexion, which is a big thing most of the time when we work on these horses, because of the nature of all of this contracture, their AO joint is stuck a little bit in flexion. And if an AO joint is in flexion, it cannot have lateral bend. It doesn't work that way. And if an AO joint can't get into lateral bend, you now have no axial rotation through your spine. That's why going behind the vertical is bad, because you lose access to your spine. And so people try to, they understand they want to get it open, but they're not alleviating the issues that's actually causing the problem. And then that's the contracture. So that's causing them to come behind. And then it's secondary cause to the fact that they don't have a sling. So their base of support, the only base of support that they have truly in their cervical spine is C2. And that's why they're C2 high. So it's not just a training style, it's understanding what's going on within the body as well.
I love that. This has been really, really interesting. And of course, I remember what I forgot to say earlier. And I'd love to mention that, because I think it ties into a little bit the last question that I want to ask you, in that, what do you think our responsibility is as vet rehabbers to help bring change? But in asking you that, I want to give a shout out to Gillian Tabor, who just changed her logo. I saw that earlier today. And why this is important is because the image that we put out into the world creates what is normal, right? What people's perception of normal is. And so Gillian's original logo had a beautiful horse being ridden in dressage, but slightly behind the vertical. And the new logo in front of the vertical. And I love that she changed that, because it's very subtle, and you're probably not going to notice it, but it makes a difference to what we perceive as normal, and we need to change that perception. So I shout out to Gillian Tabor. Good job. I love that. So what do you think
it's really important?
is.
Yeah. Yeah, no, I mean, like, things like that are a huge thing, and I try really hard to not comment on social media things. It's tricky because when you're and I for the record, I hate the term influencer, but if you have any amount of following, that's the reality that you are. Like, if you are educating, it doesn't matter what you're doing. If you're educating and people are coming to read your things, you are influencing their minds. And so it's really important that the images that you use back what you're saying. And so I could show all kinds of images of horses in progress, right? Like, I mean, like, it's not ever perfect all the time. Even on the best of the best horses, you're going to have ugly moments. That's just the nature. It's the art of horsemanship is you're going through, it's never perfect all the time. But if you're not really careful about doing your image choices on what should be correct, people don't look at that and say, oh, well, they're almost there. It's like, unless you're doing a visual changing of the eye where like you have the same horse and you're like, okay, here's a progress photo. But if you're just using the progress photo, what I find is people then are like, oh, well, that's good enough. The horse is a little tilted in the head. It's not perfect, but that person posted it and it went with this educational post. So it's okay if my horse's head is a little bit tilted. And like, you just have to be really careful. And it's a real pain. It's hard. It's hard for me because I feel like it's a demand of perfection all the time. And that's exhausting because none of us are perfect and none of us can do that. But when you're educating, being very careful that what you're doing is as correct. And what Jillian did is huge. I had another girlfriend that did that. She started a nutritional company and a sports medicine company several years ago. And she used her late gelding that was like her heart horse, the love of her life. She used one of his images from a show as the logo, but he was a little bit behind the vertical. And at the last minute, she was like, I'm going to Photoshop it. So it's still him, but that he'll be up in front of the vertical so that when people see it, they see that this is a normal thing that's the image that we want to go for. And it's huge, those little things. It's incredible. And the other thing is just really trying to from a trainer perspective, I think the best thing that anybody can do in terms of trying to help shift the change is giving people an alternate answer. You can't just go to them and say, behind the vertical is bad. You can't do that. Stop doing it. It's not going to work. You have to go to them and say, behind the vertical is caused by this thing. Do you know what's going on within the anatomy changes of the horse? Do you know that how we need to train for the modern horse today is maybe not exactly how they were explaining it in the classical literature? It's very close, but if those horses had all of the spinal attachments and they had the support, they would not need the little subtle things like my work. Everybody says that my work is the missing piece. It's the missing piece to classical literature. It's like the number one thing people say. And I'm like, I don't know that it was the missing piece. I think that it was the missing piece for today's modern horse. Because I was trained, my lens was trained on today's horses. It wasn't trained on the horses back then. It was trained on the dysfunction and what we're seeing today. And those are two very different things. And so being able to educate and give people the why and the answers of how they can continue to show, how they can continue to compete, because they're going to do it whether you want them to or not. There's nothing we can do about it. But in my experience, when you can educate them and you can give them a different answer and say, hey, like I am with this client, you can still show what you're doing. Let's tweak how the tongue is working. Let's tweak how you're handling the bit. Let's just do a few changes so you can still keep your goals and we can protect our horses and advocate for them. I think is going to be where the biggest changes are, because you can't just say no. It doesn't work.
Yeah, I love that. Yes. So Morv is saying it's the missing piece for us now. So I love that. Thank you. All right, I'm going to end us off. Thank you, Celeste, for your time today. Guys, if you are not familiar with Celeste,
so welcome.
Find her on
Facebook.
Learn, check her out. There's some really valuable stuff there, and it's worth exploring and worth investigating. And then from Online Pet Health side, the Veterinary Hub Summit is on the 31st of August. Save the date, put it in your calendar. Ticket sales open next month. We're very excited, and we're exploring the ethical issues that we face as veterinary hubbers. And I think in today's world, it's really important that we go there and that we dive deeply into what each of us stands for, how we bring that message to our clients, and how we advocate for our patients, because it is necessary. And then if this was really fascinating to you, this conversation, I highly encourage you to watch our webinars with Dr. Ulin Osborne, because they tie a lot into what we've spoken about today, and they bring a perspective that is different. So they're going to say some things that feel new and weird and strange to you. And different is good because it challenges the way that you think. So go and enjoy them. They're great. All right. Thanks, Celeste.
Awesome. Thank you, guys. Bye.